Hi, I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. I want to talk today about ultrasound. That's this machine sitting behind me here. So, ultrasound is a really cool tool that we can use to see soft tissues, which are tendons, ligaments, nerves. We can even see joint spaces or when there's swelling or effusion inside of a joint. This is probably one of my favorite tools in this whole practice because it allows me to do multiple things. We can use it for diagnostic purposes. We can see, say, a rotator cuff. We can see the supraspinatus as it comes over top of the shoulder here that is commonly torn in a lot of people that have shoulder pain. We can see little small micro tears or small partial thickness tears. We can really go down to the millimeter, even sub-millimeter level sometimes to be able to see where that damage is. And in some cases, this can be more helpful than MRI, or it can help to supplement a current MRI. If you have some injury or tearing there and it doesn't show up super well on an MRI, we can use ultrasound to get really close to that tissue and see the extent of the tearing. The other fantastic quality to having an ultrasound is for the injection portion as well. This is a really important piece that not everyone does image guided injections, whether that's ultrasound or fluoroscopy guided, which I think is a huge disservice to the patient. What we can do with the image guidance is we can see exactly where the needle is being placed into the joints, into the tears, where there's actual damage to the tissue. So when we do our injection, you're getting it exactly where you need it to be. This is kind of like, so for example, in the shoulder, the AC joint, it's a really small joint. They did a study where they injected dye into this joint without any image guidance. And then they looked at how accurate is a palpation or quote unquote blind injection. And the number was about 45% of the time people were accurately placing the needle inside of this joint that you can really feel on the skin. That's basically it would be like if you went to a restaurant and you ordered some food, you paid for your food, and then the waiter or waitress said, "Hey, let's flip a coin now to see if you actually get your food," right? You'd be pretty frustrated. And that's kind of the same thing when you do injections without any sort of image guidance. So if you're going to see a regenerative medicine practitioner, always ask to see, do you guys use imaging modalities of any kind, whether that's ultrasound or fluoroscopy, to do your injections so that you can feel comfortable and safe and know that the injections you're paying for are getting to the places that they need to be.